What are surgical drains for after breast augmentation surgery? Imagine going through a breast augmentation and wondering what those small tubes are doing after your surgery. Surgical drains are tiny, flexible tubes placed temporarily in the breast area to help your body heal smoothly. Their main job is to remove excess fluids like blood and serous fluid that naturally collect during the early healing phase. These fluids can build up in the space around the implant and tissue, which might cause problems if not managed properly. By actively draining these fluids, surgical drains help prevent complications such as hematomas, which are collections of blood, and seromas, which are pockets of clear fluid. They also reduce the risk of infection that can occur if fluid builds up and becomes a breeding ground for bacteria. Additionally, drains help decrease tension in the tissues, making the healing process more comfortable and potentially speeding up recovery. In breast augmentation specifically, the use of drains is a bit of a topic of debate among surgeons. Some prefer to place them routinely because they believe drains help evacuate blood and fluid, lowering the chances of hematomas and seromas. They also allow surgeons to monitor bleeding by checking how much fluid is coming out and what it looks like. This can give a good idea of how well the patient is healing and if any issues need attention. However, many experienced plastic surgeons avoid using drains in straightforward breast augmentation procedures. Thanks to advances in surgical techniques, such as meticulous control of bleeding during surgery and less invasive methods, the need for drains has decreased. Some surgeons think that relying on drains might suggest less confidence in the surgery's precision. They also note that keeping drains in for too long can cause irritation and might even increase fluid production. Drains are more commonly used in more complex breast surgeries, like when tissue needs to be removed or reconstructed, or in cases where larger dissection occurs. For simple implant placements, many surgeons decide that drains are unnecessary unless specific patient factors or surgical circumstances suggest otherwise. When used, drains are usually inserted through a small incision near the surgical site. They are connected to a soft bulb that gently suctions out the fluids. Typically, drains stay in place for about 1 to 3 days, but sometimes longer if there is a lot of fluid. The surgeon will monitor the amount and type of fluid coming out to decide when it's safe to remove the drain. Taking care of the drains involves keeping the insertion site clean and dry to prevent infection. The collection bulb should be emptied regularly, and the site should be checked for signs of redness or swelling. Proper drain management can make a big difference in your comfort and healing process. In summary, surgical drains after breast augmentation help remove excess fluids that could cause complications and support a smoother recovery. While they are less commonly used in routine procedures today, they remain as important in more complex surgeries. Whether or not you need a drain depends on your specific surgery, your health, and your surgeon's judgment. Always follow your surgeon's advice and ask questions to understand what's best for your individual recovery.